from KAMR Local 4 News. With Megan Collier and Andy Justice, this is Studio 4.
Breast cancer is the second leading cause of cancer death among women, exceeding only by lung cancer. 1 in 8 women will develop breast cancer sometime in her lifetime. Early detection, of course, is the key to survival. So when new technology comes to Amarillo, we are always very, very excited to tell you about it. So today we are joined by Dr. Lova Arenivas, joining us from the Texas Breast Specialists in Amarillo with a new way to detect breast cancer earlier. This is so exciting. I love news about early detection.
And so do I.
Very good. Okay, so let's talk about it. It's 3D mammography, right?
Yes.
So what differentiates it between the mammography that we're all more familiar with?
So 3D mammography is an evolution on the 2D digital technique that came out a few years ago. And what it allows us to do is to look at the breast tissue in layers rather than just a flat image of the breast tissue. So we're able to see in between the pages of a book and see clearly lesions and normal structures within the breast, which allows us to differentiate between normal and abnormal structures and lesions in the breast.
This sounds like a game changer.
It is. And research is so exciting. Research in the field has shown that 3D mammography improves breast cancer detection by up to 40% compared to 2D mammography alone. And it also decreases the false positive rate by up to 40%. And what I mean by false positive is the chances of a woman being recalled after she has a screening mammogram to work up something that the radiologist sees that is questionable. And we want to make sure that there's nothing there, so we call them back to see whether what we're seeing is real or is just false lesion.
Sometimes that can cause a lot of anxiety on the part of the patient, right?
It can be very anxiety producing, and I'm so excited with this technology because the chances of a woman being called back for something that's not real are a lot less, and it will decrease the anxiety a lot, and also allows me to be more confident in my interpretation and diagnosis.
You're the person who looks at all of those scans.
I am.
I mean, what an incredible job to have, to know that you have helped so many women in our area.
Thank you.
I think it's so amazing, though.
We are a team at Texas Breast Specialists. There's a team of us that do an amazing job, myself and Dr. Kasha, and just the team at Texas Oncology. We're committed to breast health, and this is one of the reasons we brought this technology to Amarillo, and we are proud to be the first in the area with this life-saving technology.
It's only been around for a few years, you know, and so we've been having discussions about mammography for many years now. How soon should women start to get it? We always want to tell people, you know, kind of the basics. When should you get your mammograms?
I tell women they should start their screening mammograms at age 40 and get it on an annual basis, and this is in accordance with the American Cancer Society guidelines, American College of Radiology guidelines. Early detection saves lives, and we know that, and that's how mammography has helped decrease the mortality rate from breast cancer since we started doing it consistently in the 1990s. By finding cancers early, we are able to treat them and able to offer women more options as to treatment, less invasive treatments, and we know that when we find a cancer in its earliest form, there's nearly 100% survival at 5 years.
When you got into this, did you ever think that you would say that line, that there's nearly 100% survival? You know, I mean, many years ago, a breast cancer diagnosis was very sad. You know, we were all, I mean, it seemed hopeless almost, you know?
Yes, we've come a long ways in the last 30 years, and with treatment, early detection, you know, my hope is when my daughter's older that we can say, you know, this is a disease, women won't fear it anymore, and we come where we have a cure for a lot of it. And now with the technology that we have, and we keep advancing our technology, I think it's brings great hope to patients and to clinicians.
Certainly, certainly so. Okay, so this benefits, and who is this for? This
benefits all women who are getting mammograms. It is a superior mammogram to 2D alone, and so I believe that if a woman is going to get a mammogram, she should get the 3D 2D combination. It's for screening and also for diagnostic purposes. And at Texas Breast Specialist, we encourage all women who come to our facility to get this superior mammogram.
Okay, so again, Texas Breast Specialist here in Amarillo is where you can access this technology. For an appointment, you can call that number there on the screen. We appreciate you, doctor. Thank you so much for coming by.
Thank you so much.
All right, coming up on the show, the experience of